All attendees are in listen-only mode.
Hi everyone, this is Rachel. I am the Communications Specialist for BCatch, and I'm pleased to be here with you today. I hope you're having a good week so far. If we haven't met before, thanks so much for tuning in today to this webinar. Hopefully we'll have a chance to chat in person or by phone sometime in the future. Just as a bit of background, I've been working with BCatch for about 6 months now. I'm a communication strategist by trade, and I work with a company called Tomorrow Today. And my work with BCatch has been just one of my favorite parts of the last 6 months, and I'm really excited to be diving in and telling you a little bit about what I've been working on and how you can apply some of the same kinds of thinking and tools to your own work in your center. So my goals today are really just to demonstrate the value of thinking strategically about communications, hopefully give you some tools to develop a strategy of your own. But I'm really just aiming today to equip you to take the first couple of steps in leveling up whatever communications work you're already doing. So I'm not expecting you to walk away and put everything I say today into practice, but hopefully it sparks some ideas, catalyzes some brainstorming about what kind of stories you could be telling and how. And so the format of today, I'm going to walk through 3 different communications how-tos, and there's a little worksheet for each of them that I'll reference and give you some more information about. And out of this webinar, we'll make sure that those PDFs are available to you with a bit of a video of the slides that I'll present today, so that you can take this to your team and take it farther. I also just want to mention that I am on the traditional territories of the Lekwungen speaking peoples today, and I'm coming to you from Victoria, and just really grateful and humbled by that fact, and hopefully turning that feeling into some fuel for the equity-based work that we're doing. So I want to start out by talking, the first how-to is going to focus on how to build a communication strategy. And I'm going to go through a little bit of a step-by-step. If you want to use a slideshow like this as a template for your own, that's great. Or if you want to pick up on the worksheet at the end. But what I want to start with is just reminding you that there is another webinar you can look at for background on this approach. It was from earlier this month, and it's available through the Canadian Association of Community Health Centers website. I can get you the link. That looks more at the theory and the background of storytelling as an approach to communications. And we walked through this mountain metaphor, so I'll reference it a little bit here, but you're more than welcome to check out the webinar for additional context. What I want to present to you on the stage is really just to answer the question of why would you build a communication strategy as a CHC? And so I want you to be thinking about the fact that comm strategy can help you activate the story that you're already telling as a CHC. So we want to focus on, what are we doing as community health centers that other people need to know about? So a communication strategy can help flesh out what challenges you're focused on. So what kind of mountain you're scaling in your work, if we use that metaphor. What role we're playing as CHCs, so how our perspectives and our resources, our solutions kind of feed into this story, and where we're headed, what trees we're reaching for, and what path we're taking, and why we're working this way. So really talking about the values that give us the courage to climb. And we also want other people to know how they can tap in with our work and get involved with it. So the purpose of our communications strategy is really to engage audiences. Think about who's in our sphere of influence, the group of people that we're climbing with. What's the context for engaging them? What's the weather like for this climb that we're doing together? We want people to know how they can join in with us in building solutions, so how they can contribute their perspectives, their resources into the solutions that we're tackling, particularly given the root causes of the problems we're trying to solve. So that's the cave that's sort of destabilizing the ladders and bridges that we're building up. So this is just the really broad strokes of why we would take on communication strategically in terms of telling our story and engaging with others. And the main areas of focus that you'll hear me mention lots today is around messages and audiences, the platforms and projects that we're using to reach them, and the supports that are necessary to get there. So those are the main pieces of today. And I hope what you take away is a bit more confidence about what you're saying, confidence in translating the evidence that you're using to back up what you're saying, that you create some consistency in how you're saying what tone and voice and messages you're employing, and that you feel unlocked in your creativity in your engagement with your stakeholders through a whole bunch of different platforms, so that each audience gets its own tailored approach, and that you have a sense of clarity about what kind of capacity this actually takes and what kind of supports are on hand to make it happen. For VCATCH, when we were working on our communications strategy, the first thing I did was look at where is the overlap between our communications pieces and the overall strategy that our CHC is taking. So that's a good starting point. And you'll see here 4 main categories that we're focused on in terms of making our communications really work for us, to engage people strategically, to make sure our messages are clear, to increase capacity amongst our members, people like you, to do this communications work. And because we want to create a common culture of practice across CHCs. So these are all different ways that our communications work overlaps with our strategic priorities. And it's a good place to start in crafting your own strategy. Another good place to start is to really think critically about the stakeholders and audiences that you're trying to reach. And so one way that you can do this is to think of them in different categories based on how engaged they currently are with the work that you're doing. So it might be possible that your board members are quite engaged and quite actively trying to help you tell your story. But perhaps your staff team isn't as familiar with what makes you a CHC and what it means to work at a CHC. Perhaps the community of people that you're targeting in particular with your services and programs could be brought in more deliberately in your communications work. And perhaps there's groups of people out in the public who would support you if they had more opportunities to do so. So just starting to identify audiences is a great way to begin. And then you can start to think more granularly about the goals that you have for those particular kinds of people and the strategic actions that you might take to further your goals. And the key here is to be thinking about the fact that that the strategy would be different for each one, and that the way you say your message, the place you put your message, and the intention you put behind it will be subtly different depending on who you're talking to. So this process is really just about starting to put on paper who you're trying to talk to and what their relationship is to your story currently. Thinking about levels of engagement is one way to approach this. Another way is to think about the different types of people that you really would like to receive your messages. And so this is more thinking in terms of a category of an audience, people like government leaders, people who work in health systems, people who work in a community-based organization with a similar goal or mandate to our own, or perhaps patients and clients of yours. These are some categories of people that I think every community health center should be focused on. And again, we can think about what their relationship is to our story currently, as well as devising specific goals and strategies for each one. And these don't have to be really intensive goals and strategies. They can just be a couple of jot notes for each. But your goal for government leaders might be something like, make sure they know that your CHC exists. Your strategic action might be to call them, to send them information about your programs and services. That might be slightly different than the way you engage community partners. Maybe have a slightly different ask for those partners, a partnership in mind, or a campaign they could take on with you. But your goals and strategies will be subtly different for each one. But even across all of those different audiences, we want to know what the really strong key messages are that we're going to be sharing with each of them, even if those messages shift subtly depending on who the audience is. It's important that everyone on our teams knows what matters, what's at stake, what do we want, and what will it take. And for those of you who are able to tune into webinar 1, these questions will sound familiar. But this is the narrative arc that I apply for all of my communications projects, and I find these prompts really useful in establishing key messages. So if you haven't already worked with me on a profile for your CHC, I hope you get in touch and do so, because this is a good way to start to carve out a couple of key messages for each of these points, so that you're returning to similar messages no matter what audience you're talking to. And to take this one step farther, once you identify what those messages are, the next step might be identifying barriers to actually communicating those specific points. So this is really about thinking about why aren't our ideas as CHCs more dominant amongst the audiences that we're trying to reach? And there's some good reasons for that. This is just a couple of examples I came up with on the fly in these jot notes, but a challenge to communicating our challenge to communicating the mountain we're climbing is that the work that we're doing isn't always well identified or documented. Our work isn't always considered core to the health systems that we're a part of. and even people who work at CHCs might not understand the complexity of the challenges we're trying to overcome by working the way we do. So that's just a quick example of some of the barriers to communicating why we exist and what matters to us. And you can apply that same line of questioning to each part of the story to start to establish a more strategic approach to telling our story. Flipping ahead to the outcomes point here, when we talk about what we want in working the way we do, it's important to ask if our vision for the future is clear, or if it's maybe a bit foggy, if we could be more intentional about telling stories about what communities would look like if our centers had more stability or more support. And once we have those key messages, the next step is to think about the platforms and the products that will be vehicles for those messages. And I encourage folks to think about ways they're already communicating key messages before tackling new platforms. But there are likely a mix of both that you can be taking on. And so this is just a kind of a quick list of some platforms you might already be using. Social, traditional media, starting to list where you're already engaging with people, where you've had success in communicating with the public or with reporters in the past. In the green slot here, we've got more internally focused communications or communications that are coming directly from your staff team. That might be things like newsletters or websites, information about your center that exists on other websites like the BCatch website. It's possible that you're already developing resources and informational materials about the work that you do, maybe an infographic or a one-pager. Hopefully you're doing some reporting, whether that's just about the financial work that goes into your work, or whether it's some of the impact that you're having, research papers that you're partnering with others to develop, and perhaps there's advocacy work that you're doing, whether publicly or more informally or behind the scenes, press releases that you're writing, or community events that you're a part of. Each of these are platforms that you're using, hopefully already, to communicate your key messages. And the goal here is that you would just apply a bit more strategy across these platforms and integrate them as much as we can with the work that BCatch is doing to make these messages go farther. So I'll talk about each of these pieces a little bit more in the next toolkit that's coming up. But the key here on this slide is just to see that there's a number of different initiatives that we're doing with BCatch that are designed essentially to be platforms that you can leverage for your own work. So I can offer support in each of these, whether it's a hashtag campaign, the profiles, newsletter impact stories, or a couple of the new initiatives that we have coming up, like a day in the life and the CHC micropod. I'll talk about more of these in more detail in a second, but there's a few different ways that you can be engaging with us if you're feeling overwhelmed, or like if you're feeling like your existing platforms and products aren't quite giving you the reach that you want. So when you start to take on lots of different projects and platforms, it's nice to be able to organize them in a way and see what you're doing to be able to lay it out more strategically. So this is an example from what we're working on for the communication strategy for BCatch in terms of a timeline, and just laying out what our goals are when we want to publish newsletters, what kind of work would kind of be in the lead up to each of those. Within a timeline like this, you can also pop in community events, important political moments, other things that are going to influence the messages that you have for people. But putting it on a timeline or a calendar is just another good way to get organized and assess your capacity to do the things that you want to do. Another good way to kind of map out your capacity and your reach is to actually put your key partners and stakeholders out in a bit of a map. This isn't about establishing hierarchy, it's more just seeing the connections between the audiences that you have. So we don't exist in silos, of course. We're all sort of interacting with each other and starting to see, you know, what are those departments, who are those individuals, what are the organizations that you want to work with. This helps take your audience assessment out of the abstract and more into tangible terms that you could actually act upon. So this is just a rough start for BCatch. There's a lot more partners and audiences that we have in mind, but this is one example of a way to lay them out. And in terms of establishing a common culture of practice through our communication strategies, this slide is showing that there's some work to be done yet in terms of establishing key messages about those core aspects of our CHC work. that we can be bringing in really regularly across members and across BCATCH and the Canadian Association as well. So this is something that Scott Wolf and I are working on, coming up with some go-to phrases that really cover the core concepts of our work, so that we can be all working together on making sure those are really sticky messages for our audiences. So this is the handout that I've prepared to kind of cover the material I've covered so far. And this is the idea of this one pager is that it's something that one or two people from your team could take together and sit down and work through a couple of questions that could be the basis of a communication strategy if you don't already have one. And if you do have a communication strategy, these questions might be just a good exercise to sort of assess where you're at, update things based on the shifts that have occurred across your audiences over time, and hopefully give you a sense by the time you get to the bottom of the handout here, what kind of platforms or products you want to prioritize in the near future, and what sort of supports you're going to need in order to leverage that. And I think in the next little toolkit here, you'll have a clearer sense of what that might look like. But it's great to start before you get too tied into sort of the things that I might want to work with you on, or what BCATCH is up to. It's great to start with your own center strategy and build your communications out of that, and then seek alignments afterwards. So I can definitely help anyone get started with this, but this is sort of step one, I think, in terms of creating a strong basis of strategy to build your communications out of. I'm going to go right into our second how-to, which is about the sort of nuts and bolts of crafting a CHC story. So our first webinar was really about the theory of storytelling, getting you comfortable with the idea that crafting narratives is a really important way to create change. And now I'm going to talk a bit more about the specifics of crafting the stories. I had originally called this how-to cooking up CHC stories, because I'm going to try out a cooking metaphor on you today. I realized that sounded a little bit too much like I was making things up. But this is the idea, is that we're going to put the ingredients together and come up with something truly delicious when it comes to telling our stories as CHCs. So we're going to move away from the mountain metaphor and dive into a cooking metaphor now. I want to, in this how-to, outline 4 parts of a good mobilizing CHC story and kind of break down the elements of what we're working with. So I'll dive into a bit more detail on each, but in broad strokes, we're talking about the main course, the thing we're going to show up for, which is really human stories, and talk about why that is. We're going to talk about including some veggies, the things that we need to be telling strong stories, the things that sustain us. And this is all about the data points and the evidence that serves as the foundation of our work. We're going to talk about the seasoning and how to sprinkle in a bit of a taste of our unique culture as CHCs, how to bring in those core concepts and key messages, and then how to finish off our stories with something rewarding for our audience. And that looks like a call to action or an invitation to engage further. So getting into a bit of detail around this, I'd really like to communicate to you all that you have the ingredients for great storytelling in your work already. And so this is about kind of organizing and drawing out the pieces so that we can cook up something delicious. But it's more about focusing on the pieces that you have in front of you. So when we're talking about the focal point of the stories that we want to tell as CHCs, I always say that we want to focus on people. And that's because people engage better with human stories. I was thinking this weekend, I was reading some of the news coverage of the fires in California. And of course, there's a lot of information to communicate through those stories. But the news article that I opened up, it didn't start with statistics on how much land had been burned up. It didn't talk about how many people had been evacuated. It started with a story of a single firefighter trapped in a really sticky situation and talked about how he felt thinking about if he'd return home to his family that night. And the reason the journalist did that is because it's a compelling way to get our attention, to bring us in and really help us empathize with the situation. And of course, they filled in the gaps about the informational pieces after, but they bookended the story around a person. And so this is what we should be doing with our CHC stories as well. We should center on people in our communities, on our teams, those who use our services or benefit from our programs, people leading our work and making a difference in our communities. And you don't have to go too far or find some kind of ringer, awesome, charismatic person on your team to make this work. This is about the stuff in your everyday pantry. We can make great meals, great stories out of the stuff that you have on hand. and you don't have to look far. It's more about thinking about who on your team might have a good reason for working at the center you have. Who walks in your door every day because they feel safe and welcomed by your team. That's a great story to tell. And there's lots of support on hand for developing these. So I'll mention a few projects in a second here, but there's a number of ways we can partner together to tell these stories. In addition to telling and focusing on human stories, we want to also convey the factual information that we have to share with people. And I'm using the metaphor of vegetables for this only because these are really, sustaining parts of our work, and we need to include them. They're healthy for us to be drawing attention to, but we really want them to taste good. So the idea here is that we're grounding our stories in strong evidence and strong data points, and that we're bringing the highlights from the research that grounds our work. So CHC stories should include information about the challenges we're facing, about our unique approach to making systems whole. It should include information about the measurable impact that we're making, and also about the conditions that we need to thrive as CHCs. So these are all places where facts and information play an important role. But if the veggies are the main focus of your meal, just make sure they taste good. And so it's just about not serving up the facts in a bland way. We really want to include those human stories, include those key messages and core values, and here are those 4 questions again for you. Ask yourself, what matters about this information? What's at stake given what we know? What do we want? How do we want these facts to change moving forward? And how can your listeners or readers do something about it? What will it take from them? So don't forget about the veggies. And when we're talking about seasoning, when we're talking about bringing the goods forward, this is what we're talking about in terms of sprinkling in our unique culture as CHCs. This is about connecting the dots back to our core concepts, our strategic messages, and no matter who is sort of the focal point of the story, always taking an opportunity to sprinkle in those references to health equity, to the social determinants of health, working upstream, working in integrated care teams. These are the things we want people to always have as sort of a taste in their mouth when they hear the stories that we're telling. So think about how your story personally, or the people around you, how those stories embody these principles, and how we can be strategic about highlighting the work that you do in order to get people more familiar with these kinds of concepts. And we do go into a bit of detail in that in webinar 1, so feel free to check that out if you're curious about what those messages are. To close out our metaphor here, the last piece is about the dessert, the tasty part at the end of the story where we really leave people with something engaging. And so no matter who the focus of the story is, or no matter what facts we're including, we want to make sure we're creating change through our stories. So we want awareness to grow, we want support to grow, we want more stability in our work, we want more people served in the way that we work. And so we should be finishing with specific calls to action for the audience that is in question, and make sure they know how to support or engage in our work when they walk away. So think about what is the piece of this story for them, and how can you help them feel as if it's really necessary for them to join in on your work. So how can we tell our stories in a way that avoids emotions that hold us back from action? Things like inertia or apathy, isolation, fear, or powerlessness. These feelings keep people in their seats, but we want to sweeten up our stories by evoking feelings that are activating, like a sense of urgency or outrage, solidarity or togetherness, and a sense that there's hope here, we can really make a difference. So I want to present a couple of recipes for putting these ingredients together. And these are the story projects that we're kind of focused on in the near future with BCatch that you can kind of join in on. So you can take a closer look at this on another time, but I wanted just to give you a sense of the step-by-step for working in some of these together. And the first example is a day in the life of a CHC. So this is a story project we're starting out where one CHC on a given day could work with me to develop posts on the hour, and we can kind of give a full day's perspective of what it's like to work or be at a CHC. And the first step is really just to put a project like this on your radar and then bring this up at a staff meeting. Pick a small group of people, 1 or 2 people who want to work with me on coming up with what these posts are and who would be sort of my point person throughout the day. And then we would just come up with the material together, and I'll be very much on hand throughout that day for the actual posting, checking in on the plan. But this is what it might look like. You know, in the morning, we could give some background on why your CHC exists. We can do a tour, a little video or photo tour of your facility. And we could do a little interview with some of your staff about, you know, why they work at a CHC or what it means to them. Present some news or research articles that give more context. Talk about your programs, and then make sure we've got a call to action. It's going to be a lot of fun to feature your work in this way. Another project we're taking on is just a very short little podcast that would have 2 to 10-minute episodes about the work of CHCs. Very similar step-by-step for this recipe, just bringing this up at a board meeting, at a team meeting, picking a couple of people who might be open to being interviewed or identify people to be interviewed. You don't have to have a topic or a story in mind. It would just be a matter of getting in touch with me and brainstorming some questions. And these are just a couple of episode ideas I had in mind. We could talk about health equity, how this looks on the ground. We could hone in on a specific type of community and the challenges that they're facing, like a rural community. We could talk about you know, things like stigma or complexity of challenges that keep people back from health and well-being, and talk about the importance of belonging in different contexts. We could really paint a picture for our vision for health in BC in the coming decades. And so there's lots of different ways we could tell our stories in short and succinct ways that kind of fall under some of these thematic categories. Another example is the profile project we've got going on. If you haven't already talked to me about the key messages of your center, definitely get in touch. And if you have gotten in touch with me and you're just waiting on your profile, that'll be coming your way soon. But the steps here are, again, just to work with me on coming up with some key messages, refining them, and creating a document like this to be able to use on our website and perhaps your own website. We're also creating some print versions that are a little bit more easy on your printer. And there's a number of opportunities for creating tools like this in the future. The last one I'll present here is just on every newsletter that we're creating. We're doing quarterly newsletters now, and we're trying to feature an impact story in each of those. So again, if this is something that you'd like to participate in, just send me an email and we will come up with a short video or a short interview about the work that you're doing. And last month we had a great feature of island sexual health in their education program. So if there's a cool program or an interesting event or something cool that happened in your CHC that you want to talk about, we've got a number of different platforms for doing that, and you don't have to go too far. It's really just about bringing this up at a meeting, emailing me, and getting the ball rolling. And this is the worksheet for this how-to. It's really just about kind of brainstorming the elements, the ingredients of your stories, and then maybe thinking about which of these recipes you might be interested in taking on with me, and then making a quick plan for next steps. Just going to power right through and present the last how-to, and then we'll open it up for some questions and discussion about how this might be coming in handy, or what challenges you guys are facing in putting this stuff into practice in your work. So this last one is about leveraging media platforms. It looks a lot like the communication strategy, but it's just about going into a bit more detail about social media and traditional media platforms and how we can get more granular into being strategic with them. So just like with the communication strategy, we want to start this piece of the strategy by thinking about the types of audiences that we're engaging with. So again, if you're using social media, or if you know you've got a newsletter every month, or if you really want to amp up the way that you're working with the reporters in your community, start thinking about who the people are that you're trying to communicate with. And you might choose slightly different titles for these groups this time around, thinking less about specific types of people like your board members or your staff, and thinking instead about people who really understand and are championing the work that you're doing, or maybe people who like what you're doing but they don't see a role for themselves in supporting you. They're taking more of a bystander role. You might be trying to engage with people who really don't know who you are or don't know what you do. Maybe the goal there is a bit more about awareness and educating people. And maybe for those truly disengaged from what you're up to, the goal is more to get their attention, or to give them a human face to put to some of the concepts that they're hearing about in the news. So yeah, just another way to organize your audience, but it's important to start with that step and think about who you want to communicate with and come up with some goals for them. And then not to forget the community and government leaders that you want to prioritize as well. So just thinking about the different reasons that someone might be interested in what you have to say and what their existing relationship is to your work. Again, we want to remind ourselves of what those key messages are that we want to be bringing forward, no matter what the platform or media space is that we're working in. So coming back to that overarching story that we're trying to invite others into, this is an example from VCatch. But you'll see I've added another column here that starts to think about the specific stories that we would tell to hit on that piece of the overarching narrative. So, you know, when we're talking about why we exist and what challenges we address, bringing stories forward that highlight the problem might be an important piece of the puzzle, especially when we're talking about inequities or complexities that create different challenges for different audiences or different communities. But we also want to remember to tell stories about the role that we're playing in actually, you know, making systems whole and filling in some of those gaps. We want to tell stories about the impact we're having and the way that the model could grow. And of course, we want to end stories with advocacy and a clear call to action. So this is just another way to lay out a relationship between our messages and the stories that we're going to tell. Similarly, we want to see some overlap between our key messages and some of the ways that we can just bring attention to our core themes and concepts for CHCs. And here I've added in some hashtags. So for each of these areas of our core work, you can see there's ways that we might be able to engage in a broader conversation just through using hashtags on social media. But just, again, going a layer deeper into thinking not just about what we want to say, but where we're going to say it and who's going to be listening when we do. Similarly, on the map, I've started to add in some handles for Twitter. So thinking not just about who we want to talk to, but where they actually are online, how easy it would be to directly send them a message. So everything from news agencies that have a Twitter handle to people right on our board who are active on Twitter. This is an exhaustive list, but you can see there are some politicians who are accessible there. A lot of the councillors in Victoria are online, and it's actually pretty easy to add them to a tweet to get their attention, especially when what we're saying has to do with a decision they're making or resources they have control over distributing. Yeah, I think that's all I'll say on that one, but you can start to fill in the gaps and just get a sense of how you're going to reach these people that you've identified as important partners. This piece is a little bit new from the communication strategy, and it's really getting a bit more detailed into thinking about why you're working with social media in this case, and why or how your audience is engaging with that platform. So again, this is just going a layer deeper into detail. Once we know our general platforms and projects that we're taking on for communications, getting into the reasons why someone might find us online in this capacity helps us be more strategic with that. So people use social media to be entertained, to stay informed, to take in different kinds of political or social positions, connect with other people, gain new insights. This is just a list I came up with, but it helps you think about why someone might come across your messages if you're online. And for each of these categories, we can think about tailoring our messages to actually meet the needs of people where they're at. So talking about bringing in interesting messages and ideas to life for people who are looking to be entertained online. For people who are, wanting to get informed, let's make sure we're helping them stay up to date on what's relevant when it comes to the work we're doing. Let's be clear about what's happening right now, not just generally for CHCs, but how things are changing every day. We want to give them good information that they can evaluate and offer a more compelling story, perhaps, than other narratives are offering. And particularly when it comes to our analysis of issues like equity or some of the challenges to accessing health services, I think that's a really important piece, that we're framing these problems in a way that points to solutions that will actually create a more equitable outcome for people. We can also find people that are similar to us online and have good conversations with like-minded people, amplify their messages and get them to amplify our own. And of course, we can help people be exposed to new perspectives and themes that they wouldn't otherwise come in contact with. So when you're deciding between social media platforms, it's good to just get a bit of information about the differences between them. Hopefully you're using one or more of these already, but I definitely would encourage you not to overdo it and just really focus on the platforms that you're committing to. We're using Twitter most actively with VCatch, partly because Twitter users do tend to skew more to a higher educated population, and so you're not going to reach everyone through Twitter for sure, but that is a good place to be in contact with government officials, community leaders, other organizations, and people who might be, pushing this conversation forward. Its cons would really just be that posts are very short-lived, so you've got to be working at that pretty consistently to create your brand and your voice on Twitter. But it's a really nice way to engage in conversations. Facebook, alternatively, actually has a broader reach and a wider audience, especially with older people. And it's a good place to kind of build up a library of posts because they're easier to find after the fact. But Facebook is a little bit limited by how heavily it's influenced by algorithms and paid promotions. And so reaching beyond your existing audience on Facebook is a little bit harder. It might be a good reason to consider Twitter. Instagram I threw on there as well because it's a great way to reach out, especially to younger audiences. It does require you to be a lot more nimble with visual and graphic elements. But if you're interested at all in like video blogging or anything like that, Instagram might be a cool tool to check out. So these are just some of the reasons you might be posting and some of the different types of posts that you might be taking on. I'm going to give some examples in a second here that gets into this. But yeah, I would encourage you to be using social media to amplify people, to share your own content, to initiate conversations with people, and to really find your voice in framing what's happening out in the world. And so, like I said, there's a number of different projects and platforms that you can work with me directly on and work with VCatch directly to leverage. And a lot of those are going to be using social media. So if you're new to social media or you feel a bit intimidated by getting started, taking on a project with me might be a nice way to kind of get your feet wet, get a bit more comfortable posting from your organization's voice, but with some support on hand. Just really quickly, as we kind of, I'm just going to speak for another few minutes, and I want to focus on some do's and don'ts for social media. This is really basic stuff. If you've got some social media expertise on your team, again, definitely defer to them. And there's a lot of different, directions we could take this, but I'll just focus on some of the surface tips today. Starting in the top corner, I do want to encourage you guys to post and repost. So don't be afraid to use social media as well as your website to share your stories and amplify other people's stories. So definitely get started, set some short-term goals, and try something new if you're not already posting regularly online. But don't only repost if you can help it. It's really important to be sharing other people's work, but put your own spin on it as much as you can. Grab a quote that highlights some of the main themes or reframe it so that it is more relevant to the audience that you're reaching. So reframing, to go down to the middle line here, reframing is a way of just contextualizing the piece of content that you're sharing so that it fits a little bit better with the messages that we have. So if you think something is interesting or worth sharing, just take a quick second to think why. Why is this something that matters to me? Why is this compelling? And just state it. Just make it a little more obvious to the people you're engaging with what it is about this that you think is worth talking about. And don't overthink it too much. Participating meaningfully in a conversation isn't about having all the answers or asserting yourself as some kind of expert all the time. Ask questions, invite other people to share their experiences or their thoughts. And that's a great way to post as well. But above all, just think about engaging with people. And social media in particular gives you all this permission to be creative, use images and videos, hashtags wherever you can. And we've listed some of the important ones for our work down here, including hashtag BC Health, which is one we're trying to tap into. And so just don't forget your audience. Don't forget who is listening to you and what kind of information they actually want, what they're actually looking for by opening up Twitter or going on to Facebook, and why they might click on a post of yours. And if you can be thinking about that as you craft posts, it'll just make them that much stronger. So for example, it's good when we can be retweeting each other and participating in hashtag campaigns and specific days of action. But it's even better when you can add a little bit of your own context talk about why this is important to you and lead people to the work that way. Another example on the far side is a time that we were tweeting directly to the Minister of Health. So using his handle and drawing his attention to an article that he was quoted in about his position on CHCs. And we threaded messages together. So not just doing one tweet, but then having a number of follow-up tweets that provide more context, and even added some goofy, pug dog memes to get people's attention and have some fun. A couple of other examples from our members. There's a great one down here from Kool-Aid that was drawing attention to housing as a determinant of health, and they did a good explicit invitation to engage further. Lake Country Health Planning Society did a Facebook post that did a good job of bringing sort of a human component to some of the work of an emerging CHC. They linked to the work of partners of theirs and talked about a fair that they were a part of, and that's an awesome way to use Facebook. And Umbrella as well did a good job of highlighting a day of action that they had, an open house, and using photos and community stories to show the impact of their work. That's some really good work there. Quickly, we'll just kind of touch on traditional media content before I flip it over to questions from you. This is, again, not my greatest area of expertise. So if you've got people on hand on your team who do really good work with local media, I'd love to hear from them, and perhaps we could do a follow-up webinar that features some of the in-house expertise that we have across our members. But this is really just getting you to think about, there's more than just major newspapers when it comes to print media or offline media. You may be thinking about a local periodical, a weekly update that comes out from a local organization, community newsletters, and that kinds of stuff. Those can be good places to feature a story pitch, just get in touch with someone and let them know the cool stuff that's happening, to maybe talk about a local campaign or a fundraising project you're doing, or to link the work that you're doing to current events or to a community decision or political issue that's catching people's hearts and minds. And similarly to with social media, just think about why your audience is connecting with that particular resource. If it's a newsletter, why are people picking up that newsletter? What are they looking for? Do they want to laugh? Do they want information? Do they want a way to connect or engage further? Just be thinking about who it is that you're trying to reach, and how you can be tailoring the information that you have to be relevant to them. So if you're trying to produce an interesting story for a provincial news agency, talk about the provincial level scope. If it's a community level of distribution, then make sure you're really focused on the local issues. And you can do this similarly to social media across the different reasons people would use that media type. Just be thinking about how to position yourself to meet their need. Again, a couple do's and don'ts for traditional media. Definitely do reach out. The people who write these stories are people. They have phone numbers, they have email addresses, and they have a need for coffee in the day often. So take them out for coffee, tell them about who you are. You don't necessarily have to have a story in mind, but just having them know what work you're doing and to perhaps be on call for commentary or to give them a face to put to a name is a good way to make relationships. And when you are pitching stories to journalists in particular, don't forget the drama. Don't forget that they're going to be looking for the conflict or the tension or the high stakes element of your pitch. And so make sure you make it clear why what you're talking about matters right now. So they can't just push it off another week and come back to that, when things are lighter. Make sure that they see the urgency of your story built in. And one way to do that is to use press releases. So if you don't have a template for a press release already, that might be a good thing to pull together. And it just can be a simple way to share your key messages and draw attention to a particular program or service or situation that you want to highlight. But as you do that, make sure you don't get too jargony. Make sure you're still focused on the plain language that that reporter is going to have to use to speak to a public audience. And don't get too caught up in the health system terminology or medical terminology. Make sure you're bringing it back to ideas and concepts that are relevant to a broader audience of people. And no matter what you're asked or what you're talking about, make sure you're able to stay on message. So those key messages that might show up in your profile or on a communication strategy, those are going to be important when you're starting to engage media, because you don't always know what quotes they're going to grab. And so making sure that you're always saying the things that you want to say is important. And that includes humanizing the stories that we're telling. So not just coming in with a lot of facts and figures in hand, but really pointing journalists, pointing people who are writing these stories to the humans that make this stuff so engaging. And so just as a couple of examples of this in our last few minutes here, this is an example from Lake Country. I worked on this press release with Corinne, and she did an awesome job pulling together the information. But you can see on the right-hand side, this was originally framed as a quote. And what we did in the final version was break out some of the factual information from the subjective information, because the journalist can always grab the factual information from your press release, from your website, etc. What they can't make up is how you feel about it. And so you need to be able to give that information to them in the form of a quote. And so you can see Corinne here is emphasizing that the existing model is unjust, and that she's saying that they're seeking to interrupt this current state of inequality. And those are really powerful messages to frame as a quote, and then to contextualize it again in the factual information that their society has existed for a number of years and has been doing this for a while now. But a great job kind of bringing the really human, subjective aspects of this, the value-driven statements, forward as a quote. And final example, a really good job from Gray, our president of VCatch. He did a good job introducing himself as the president of VCatch, so that information made its way into this article, which is awesome. He was able to focus on characters who might not otherwise have been included in this kind of story. So he's talking about the working poor, seniors, newcomers that can't always afford dental care at for-profit clinics. He provided them with this really snappy soundbite here about an expression, put the mouth back in the body, a very quotable line there, bringing it back to evidence and a call to action. So you've got all bases covered here, and it's a great example of leveraging print media or traditional media to tell your story. So this is the last worksheet. It's really just like a list of brainstorming and activities you could take on as a small group of people trying to think more clearly about your social media or traditional media strategy. It's especially good for folks who have a bit of a strategy in place already and maybe want to go a bit deeper into the platforms you're using. And there's space at the bottom there to develop some key quotes that are a bit more focused on the subjective or value-driven aspects of our work. So yeah, that basically ties up the webinar presentation. We've got a few minutes for questions now, but I hope that those three how-to between the slides, the video, explanation that we're going to produce with it, and the worksheets. I hope there's a piece there that you can pick up and take forward with your team. But usually the first step is, again, just to put it on your board meeting agenda or your team meeting agenda. Talk about it for a couple minutes with your team, and just grab a couple of people who have a bit more interest to connect with me directly to take this to the next step. I'm a great support to be here for you guys, and it's great that VCatch has the resources to have me here to leverage for you. So I hope we can work together and bring some of these stories to our communities. Thank you.